All right, so hi everyone. As people continue to sign on and introduce themselves in the chat, I'm just going to get started with a couple of housekeeping items. First of all, we ask that you leave your microphone muted and your video off while our speakers are presenting. There will be time to come on video during the second half of the webinar when we do the Q&A period. If you have any technical issues, you can email my colleague Caroline at cmiranda@cfleads.org. She can help you troubleshoot. If we all end up having technical issues and Zoom stops working, we will switch to phone, and the phone number is here on the screen. It should also be in your emails, and we will email everyone who's on the call if we do end up having to switch to phone. But so far, we've been lucky with the technical. Just a reminder that all of our previous webinars are recorded and are available on our website. This webinar is also being recorded and will be on our website tomorrow. You can find them under the resources section of our website. And just a reminder that we also frequently update our blog with news and information about the things that are going on in the country, specifically COVID, and our most recent blog post about the death of George Floyd and the statements being made by community foundations across the country. We're collecting those and sharing those on our blog, so if you do have one, please feel free to reach out to me and send me a link, and I'm happy to share it on our website. Now I'm just going to turn it over to Deborah to kick us off.
Hi, everyone. This is Deborah Elwood. I am President and CEO of CF Leads. Thank you for joining us in another one of our webinars on community connections in times of crisis. We have been hosting this online forum, as many of you know, since the early days of the coronavirus. And this is for community foundations who want to come together to hear how your community foundation colleagues are navigating the public health crisis and the economic devastation that we're experiencing now. We started out providing information on a whole range of ways that community foundations were responding. And as many of you know, from here on out, we're going to be focusing on specific topics that are of particular interest to you. Well, it's been a really rough couple of weeks in this country. We've all been working flat out to address the horrible consequences of COVID-19. And then with the videotaped killing of another Black man, George Floyd, by a white police officer, we were all reminded in sickening detail that we're currently living with two viruses in this country. One, the novel coronavirus that we've been combating since early March. And the other, of course, is racism that we have perpetuated in this country since its inception. This is excruciating, it's infuriating, it's sobering, numbing, shameful, and this is not okay. Living with, tolerating, or perpetuating this racism is not okay. We as a country are not okay. People of color are not okay. Because this fight has been going on for so long, it's difficult to be hopeful for a better future. Marches, public commitments, pledges, commissions, new resources, and outrage in the past have not really led to the significant enough improvements for people of color in this country. So it's easy to be wary for the prospects for change. But we really must double down. As community foundations, we must commit to do better. We must listen to communities of color and take the lead from partners who've been working tirelessly for years to advance racial equity. Many community foundations across the country have been speaking out. Their statements, as Melody just mentioned, are part of our most recent blog on our website. And as Melody said, if you want to share yours, please do send it to Melody and she'll put it on our website. These statements are important, they are powerful, and they are inspiring. And many are painfully clear about the situation we face and full-throated about the need to take action. And action really is what is needed. We must not express our outrage and leave it there. We must thoughtfully and strategically work with community to dismantle the policies and systems that may have made it almost impossible for people of color to thrive in this country. We must acknowledge that this is systemic racism, not just a cultural or attitudinal problem, though those are intertwined, and we must approach it as such. In fact, you can start now in how you approach recovery and rebuilding after the coronavirus. Step up now. Create and be part of the community efforts to rebuild. Ensure equity. Bring the voices of the most vulnerable to the table. Focus on systems and don't accept the old normal. Today, we're going to hear from two colleagues from Milwaukee who are doing just that. They'll describe their cross-sectional civic response teams that are responding to the COVID-19 crisis and envisioning a brighter future. So we're really glad they're willing to take some time out from this incredibly important work and to share what they are doing with you. So for those of you who have participated in these webinars in the past, we have a common structure. We hear from a few colleagues from across the country, from community foundations of all sizes, rural, urban, all across the country. We then facilitate questions and have some conversation. And then we close out with a poem or a story that we hope will bring you just a little bit of solace in these very, very demanding times. So now I'll introduce our speakers. Ian Bautista is a community organizer at heart and serves as Greater Milwaukee Foundation's Senior Director of Civic Engagement. Ian has served in his new role since March 9th, beginning in the position a whole week before the foundation moved to its remote operations. Prior to serving in the current role, Ian served as Executive Director at the Clark Square Neighborhood Initiative in Milwaukee and President of the United Neighborhood Centers of America. He helps lead the foundation's civic response teams. And I should note that some years ago, Ian was part of CF Lee's community engagement panel, which helped us to really think through some of the important civic engagement strategies that community foundations can embrace. Ian is going to be joined by Gina Stilp, who has served as the Executive Director of a Zilber Family Foundation since 2018. She previously served 7 years in a variety of roles at the foundation, and most recently she served as Social Innovation Director at Doman Constellations, a B Corp focused on advancing health equity. Gina helps to lead the work of Milwaukee civic response teams focused on food. So I will turn it over to Ian, and we encourage you to use the chat function throughout the presentation. Put any comments that you want to put in the chat. And also, as Melody mentioned, put any questions you want in the chat, and then we'll call on you, and you can open up your mic and your video and ask the question directly. So, Ian.
Thank you so much, Deborah. I really appreciate that, that introduction. And I am honored to accept the invitation to come before you in this virtual way to talk to you a little bit about our response here in Milwaukee that we're calling the Civic Response Team, but that really at the beginning had no name, had no formalized structure, and it's really a work in progress even today, about 2.5 months into it. And I want to thank Gina for taking time out of her very, very demanding schedule today to join me to provide some real life examples of how the structure that I'll tell you about and some of the timing that I'm going to tell you about really plays out on the ground and in communities here in Milwaukee. So if you want to go ahead and advance to the next slide, I'll give you the quick sketch of the timeline. So as Deborah mentioned, I started with the foundation on March the 9th and had all of 1 week in the office. Then we started to figure out that it was going to be necessary for people to work from home. The Greater Milwaukee Foundation and many, many other organizations and offices that are part of this response team effort made a similar decision to start working from home on March the 16th. that week, on that Wednesday, my boss Ellen and Gina and other philanthropic leaders here in Milwaukee asked Mayor Tom Barrett to participate in a call to listen to how the city was responding and what priorities the city had, in the work that it was trying to balance and the public health crisis that was being thrust upon them. So as a result of that meeting, 6 different topics emerged, and I'll tell you about the 6 teams, now soon to be 7 teams that came out of that. But suffice it to say, from that Wednesday to the end of the week and then into the early week of March the 23rd, the United Way, the Greater Milwaukee Foundation, the City of Milwaukee, Gina's organization, and many, many, many others organized to start launching topic area teams that could look at priorities for urgent situations that were happening around the topics that we cover, but then also how we could respond and mobilize financial resources that many of the philanthropic partners and public sector partners were mobilizing, but also the civic leadership structure and in-kind goods, services, and expertise to be able to respond to that need. On the 25th of March, the governor of Wisconsin issued a safer at home order. On the 27th, we had the first of what we call the leadership team for the civic response team, which is really a broad community of people, organizations, and stakeholders, some of whom are deeply involved, like Gina, in the team work themselves, others who are part of that community really so that they can inform their decision makers. For example, people from a U.S. Senator's office, folks from the Milwaukee Common Council, various folks from city, state, and county government. So we've held those leadership team meetings as a way of building community and really coming together in a common format to share information with each other, but also to gain a little bit of inspiration from one another every Friday since March the 27th. On the 24th, the group of leaders, of which Gina is a part, had a small meeting with the mayor to provide some updates, which was helpful in allowing us to hone the work that we had done over the previous month and provide a little bit more focus on policy, structural issues, and other challenges that we had overcome, but that remain to be overcome. On May the 13th, the Wisconsin Supreme Court struck down the governor's safer at home order, and a little bit of chaos ensued in terms of how the public health crisis was playing out in the metro area of Milwaukee, with the city of Milwaukee maintaining, even to this day, a safer at home order, and some of the surrounding suburban villages and cities and towns opening back up their economies in a quicker way. There's a bullet there about the COVID-19 impact in Milwaukee. I won't read you all of those statistics, but suffice it to say that the COVID-19 impact has been much deeper and much more challenging in Milwaukee's 2 primary communities of color, the African-American community and also the Latino community here in Milwaukee. And then on May 30th, just last week, the governor, the mayor, the county executive, the sheriff, and the police chief activated the Wisconsin National Guard to respond to what they were anticipating to be civic unrest and some of the challenges in securing people's safety and health and some of the property in especially those communities of color that I mentioned. So we can advance to the next slide, and I'll tell you a little bit about the structure of the civic response team so that you could get a chance to see, at least conceptually, the way that it works. And so on the left, you see a representation of some of the stakeholders that comprise the response team in general. So local and state government, philanthropy, there's a heavy presence and involvement and leadership from philanthropic leaders throughout Milwaukee, educators, nonprofits, both that are providing services, but also those that are advocacy organizations and policy oriented, healthcare from many different parts of the healthcare industry, from federally qualified centers all the way to very large health systems like Children's Wisconsin, And then the community, more and more, especially over the past month or 6 weeks, the various teams that you see represented on the right-hand side have strengthened their relationships and their reliance on community organizers and those community-based organizations and leaders that are on the ground in especially the hardest hit census tracts and zip codes to be able to provide a two-way avenue of communication about what the priorities and opportunities are, but also to get resources and information in an expedited way into neighborhoods that are usually the last to find out about important information, especially as it relates to public health, economic opportunity, and the other items that we're working on. So a quick overview of the structure that you see represented there on the right. There are 7 teams, one that's in formation right now under economic recovery, and I'll tell you a little bit about that in a little bit more detail. An early childhood education team, the K-12 schools and education team, the food team, which you'll hear from Gina about to illustrate some examples of partnership and some learning that we've experienced. And it includes much more than just food. Shelter, which also includes housing and some of the challenges there, physical health and mental health. We originally envisioned that the leadership team, those Friday meetings that I mentioned to you, would be a little bit of a decision-making or recommendation formulation team. But since it grew by, I guess, popular demand and invitation, it became quickly apparent to us that it wasn't feasible or wasn't practical to have the leadership team serve as a decision-making body or a recommendation formulation body. So we then created about a month or 5 weeks ago what we call the coordinating team, which is a representative from each of the teams that you see around the circle there, but also myself, another colleague from a related entity with the Greater Milwaukee Foundation called Milwaukee Succeeds as facilitators, and then a liaison from the Greater Milwaukee Foundation for our COVID response funding stream called MK Responds. And so if you want to advance to the next slide, I can flesh out a little bit of some of the common learnings or some of the work that's part of those various teams. So the coordinating team, that kind of decision-making and recommendation formulation body has recently had a pretty deep discussion and kind of a partnership open door from the city of Milwaukee to coordinate around our recommendations as the kind of current experts in what's happening in Milwaukee on the ground around grant allocation from the CARES Act and other federal and competitive grants, but then also human resource coordination. The city is in the process of bringing on board 120 community navigators, and they're tapping into the expertise from the civic response teams to be able to define the experience base that those navigators require, and then some of the job description and expertise that they will then be trained on and engage in community with. And then also to look at emerging policy priorities with the city, but then also in partnership with the city to the state and the federal level. The various teams have some common challenges and opportunities from the very get-go since we were building the process and the system as we went. Communication amongst the teams was a little bit of a challenge, but then also communication between the teams and the community was a challenge to make sure that the community knew that there was a response effort underway. And we have done what we can to make sure that we're plugging into other efforts in response to the pandemic from various communities and various stakeholders, including a pretty robust response from Milwaukee's African American leadership, a pretty robust response from the Hispanic and Latino leadership in the city as well. And I've served in a role to try to make sure that there's communication back and forth among the leaders and among the different teams so that we aren't duplicating effort. There are many, and Gina will probably illuminate some of these, pre-existing structural and policy challenges, but also opportunities. As Deborah mentioned in her introduction, we have chosen to try to look at how we would imagine Milwaukee at its best to be when we start to plan, as we have, the future of the city working the pandemic, but also envisioning a time where the pandemic challenge subsides and we're able to look beyond that. And then logistics. And again, Gina can talk a little bit about this if she chooses, but being able to deliver goods and services and communicate about that from soup to nuts is not necessarily the expertise that a foundation executive or a foundation director like myself has, but we've tried to learn as we go, and we've also tried to tap into the community expertise to build that capability and respond. There's been a pretty high amount of funder coordination, and I'm not privy to the context that preceded me, since, as was mentioned, I'm fairly new to the Greater Milwaukee Foundation, but there's been a lot of sharing of information, of grant making, especially among response funds, among the various funders and foundations here in Milwaukee. And so I would hold that up as a success, although it's an ongoing process of continuous process improvement. We have been successful in tapping into existing collaborations and coalitions. And lest you think that we were just exceptional in our abilities of building collaboration and coalitions, this work, like I said, as a whole structure didn't exist about 2.5 months ago, but there were existing collaborations and coalitions like a mental health collaboration coalition that existed called SWIM, Scaling Wellness in Milwaukee. There's an existing emergency shelter group called the Continuum of Care that exists here, among others. So, we have very kind of heavily leaned on some of those existing relationships and some of those existing partnerships to be able to go a little bit further and build capacity in a quicker, more time efficient way. And just having the benefit of pre-existing relationships. I knew Gina way before this process started, thankfully, and having those working relationships and a high level of trust among some of the leaders who have been involved were definitely elements that helped us, I think, to the relative success that we've had here. I wanted to mention the economic recovery team. It has been under development over the past couple of weeks, and keeping an eye on the medium and long term. We know that at some point Milwaukee is going to get back to work. Businesses will start to reopen, but the economic challenges will be different than what they were before, and in some ways exacerbated from some of the racial inequities that started before. So we were very deliberate in kind of choosing the leadership configuration, as you can see there. And I would tell you that that economic recovery team's work, as they're developing their charter, has been highly focused on racial equity, and specifically looking at Latino and African American communities, and trying to lift those households and those small businesses and those workers up as a matter of priority, so that overall Milwaukee can be healthier going forward into the future. So that's all of the boring kind of detail and some of the high level stuff, but I think it's really important for you to hear from one of our leaders, specifically from the food team, which covers much more, like I said. And so I'm going to tag in Gina and tell you to advance to the next slide so she can share some of the experience of that team.
Well, thank you, Ian. You make it sound very easy. Ian's been like a fearless leader for us to keep us coordinated and moving forward. Each of the leaders of the 6 groups that Ian described, most of them have issue area expertise in the area that they're leading. And I am one of those odd women out. I really don't come to this work with a lot of background in food systems. So for me, there was a bit of a learning curve jumping in, and really do want to acknowledge, I think Ian was noting earlier that we tapped into these existing networks in Milwaukee where we had a lot of partnership and collaboration. While that is some of that in the food systems here, we have a lot of challenges around partnership in our food systems that are known and deep and have been here a long time. So I think we had some things to overcome when we jumped into this food work, in addition to just the COVID response. And so I'm really proud of where we've been able to get in a short period of time, considering some of those challenges we had in our system here. So when we initially brought our group together, we established a mission of what we were working towards, which was really to coordinate the allocation and distribution of resources to feed vulnerable populations in Milwaukee safely, consistently, and affordably. And so having set that out, it gave us a little bit of a framework for us to work from. We also, I think, had a challenge. When we think of food in Milwaukee, and I'm sure you do too, it's about community, it's about togetherness. And so having to shift that focus to safety and public health was difficult for some of our partners. And I give a ton of credit to those who were able to quickly change their models from communal meals or really high touch food pantry sites to grab and go, and having to think through all the steps that needed to happen in like 3 or 4 days about how do we change everything we've been doing to make sure that our community is still served. And so we realized in that sort of that shift phase that it was more than food that we needed to be thinking about. And so you'll see on here this 55-gallon drums of hand sanitizer and 3.5 million masks. Our food banks and our meal sites were saying we can't get it online. I'm sure your city's experienced similar. And so how do we navigate some of those challenges? At the same time, we were trying to navigate policies and to advocate for waivers and exceptions on our public funding streams. And then thinking through, once we sort of got our feet under us, what types of new partnerships do we need to establish in the food sector, both across our public and our nonprofit partners, but then also how can we pull in the private sector as resources, but then also knowing that our restaurants were closed and our economy was suffering, were there ways for us to think about the food system more than just that nonprofit emergency response, but really think about it as a way to be an economic injection in our community. So a few examples that I think I can provide are, around that, the resources and the PPE and the hand sanitizer that we needed. We were, fielding calls during our weekly food check-in around, hey, tomorrow I can get you a 55-gallon drum of hand sanitizer. Like, who can take it? Who can fill it? Who can distribute it? So Ian and I are like literally emailing people we know, trying to figure this out. But what that spurred is, we need a better system. And so we realized that we didn't have a system or a technology tool in Milwaukee where we could share information like that. And so what we were able to do is leverage a resource that Code for America made available called Neighbor Express. And so the United Way stepped in with some of our Code for America peers here and essentially built out a database for us that is public, that allows us to do data sharing. It allows us to take intake requests from not just food providers, but from daycares and schools around what types of PPE they needed. And then on the back end, we pulled in Habitat for Humanity, who has logistics experience and delivery experience to help us think through what could our distribution model look like. So we were very quickly able to not only get these resources out, but also now have a long-term tool that we can continue to build on to make sure that this is something we have with us well beyond our initial COVID response. And so very proud of that work. And our mask work has been a feat. We have a company here that figured out how to make their industrial wipes into kits that can be put together into masks for our community. And so, again, all of a sudden we had 3.5 million masks to make and distribute. And so we were able to leverage some partnerships through our Milwaukee Bucks here to use their brand new arena and their logistics and event management skills to make sure that we were not only getting those to food providers, but to residents in our community. And as I said, the food system here, I think is somewhat siloed. I think we think about it when we started, we realized we were really thinking about it in terms of, are there pantry sites available? Are kids getting fed at school? And who's taking advantage of the SNAP program? And so we started there and we started to educate ourselves about what does the supply chain look like? What are the public funding streams that we need to continue to access, but perhaps shift in order to take advantage of, and essentially to create new distribution models. And so we were able to leverage some of our existing partners around our Hunger Task Force here, Feeding America, our food banks who have expertise in the public funding streams, and figure out how to advocate for waivers on some of those streams. Some of it was at the national level, some of it was at the state level, which really allowed us to figure out how to package food safely, how to distribute it across, at this point, probably more than 40 sites in the city, have grab and go stations for families. But as soon as you solve one problem, you realize that there's another one. And so many of the public funding streams, as you all know, have so many restrictions on them, that we've really been trying to piece together this puzzle of where do we want to continue to rely on public funding streams, and then where during this really challenging time do we need to inject some private philanthropy to make sure that our nonprofit providers who are going to be out there and providing the food no matter what are made whole, and perhaps really recognizing that they have additional operating costs in order to change their models, in order to pay hazard pay to their employees and the material costs that they're having. So, you know, one of the things that we did across all of the different civic response teams was start a simple Google Doc, which sounds, you know, easy enough, but funders were able to share information we were getting about the various applications and requests across the different issue areas. And this is something that, as much as we have, I think, a very collaborative funding environment here, we'd never been that explicit about sharing such and such organization is applying for this much money for this. And we did it so that we could make sure that we found the most restrictive funding first, and then kind of went down that, funneled it to the point where who can fund operating, who can do program. And I think what it allowed us to do is tap the public money first. And as the CARES Act funding and the CDBG funding is continuing to be available, we're still looking at it through that lens of, let's go to the most restrictive funding first and apply it, and then figure out where we as private funders can fill those gaps. And that's one of the ongoing efforts I think that will also come out of this, is just really thinking through how Greater Milwaukee Foundation and Zilber Family Foundation can have a more intentional dialogue about where our priorities are. I think we've also seen, you know, as I said earlier, we had sort of these three buckets where we were thinking about food. We didn't really think initially about how do we pull in the private sector and how can we maybe be more innovative during this challenging time. And a couple interesting partnerships have emerged here. We have a local restaurant in Milwaukee that is in one of our more highly distressed neighborhoods. It's called The Tandem, and she's known for her fried chicken, and she hires young people from the community, maybe in their first jobs. But as The Tandem was shut down, they pivoted their model to essentially just being a food bank. So Caitlin, who's the owner, cooked everything she could cook in her refrigerator and quickly gained the attention of the World Central Kitchen. And so Caitlin's restaurant now is able to provide as many meals as she can provide, and had a model where folks could just come to her front door and a grab and go type model. What was interesting is she quickly started contracting with local restaurants. So now Caitlin pays $10 per meal to about 45 restaurants in the city, who have all said that without that injection, they're not sure that they would still be open. And so we started to think, how could we participate in that model? So we were hearing from some of our community-based organizations that while yes, there were food banks available, and yes, we had these grab and go meal sites available, accessibility is still a really big challenge for senior citizens and for health compromised individuals. And we were hearing a lot about single parents being home with their kids and not having resources to get to the grocery store or to these other food resources. So we're piloting a model right now. It started in partnership with Uber, donating rides to us, and Metcalf Park Community Bridges, which is a community-based organization. And we are delivering currently about 1,500 meals Friday, Saturday, Sunday to senior citizens. Currently that model is being subsidized by World Central Kitchen, so private funding, but we are working through the civic response team to work with our city and try and access some of the CARES dollars, in addition to some of our county resources, to expand that model to additional neighborhoods so that we're not being as restrictive around just being able to serve seniors or just people with disabilities, but really to individuals that are have put their hand up to and communicated with our networked organizations to say, I have a need. And so we're really curious about how we can continue this, this model going forward. And I would say it's been very interesting to bring the private sector into this work. I think sometimes when we bring private sectors in who are in for a project, they're thinking about it from that project level. And so what the civic response team has allowed us to do is keep that bigger picture policy and systems thought process ever present. And so we've assigned folks who are true experts in food systems to work on this project, so that we are always asking ourselves, you know, who else is working on this? Where else are the funding streams? We're not trying to recreate systems here. We're trying to build on the networks we have and then perhaps tweak them a little so we can be more creative about reaching additional people, not only in the next couple of months, but as we look ahead. Particularly thinking this we could very well be back here in a few months. And so what can we do now to shore up Milwaukee so that when we come back to a situation similar, we're ready to go and we've got the resources and the players in place to make this work. There's also, challenges that we're having. And I think the policy and systems change work is an ever present issue that we're having. I can speak, most eloquently about the food issues right now. And really when you look at some of the challenges we're having around SNAP funding, we don't have the ability to do food delivery, grocery store delivery on a broad scale right now to our families. And so we are advocating for some changes to allow additional delivery of SNAP. We would really love to have additional double dollars programs so that our low income populations can have increased access to fresh foods, just as a couple of examples. But what we are finding is that we're not equipped in the sense of having enough resource around advocacy and policy around food systems change. And I think one of the big issues here is that we don't have a person in our city who is really a food expert. So we've got our county and our city working on housing and some of the other issues Ian described. But food security has always fallen to the hands of the nonprofit organizations. So one of the challenges we're trying to really bring light to is that we need a food security expert who lives in the city of Milwaukee who can carry this work forward as well, and then help us shape our advocacy and funding requests to both the public and the private sector. And so the resource coordination, I think, is something that we're learning a lot about and are really helping ourselves as we think about our future in Milwaukee. Ian, do you have any thoughts about, you've sat in on all of our food meetings, so if I missed anything.
To me, it's just impressive the kind of can-do attitude, or the real, just open leadership that Gina, and then for each of the teams we have many facilitators that are helpers that kind of either work in the system, or I had mentioned earlier Milwaukee Succeeds, and many of my colleagues from Milwaukee Succeeds are serving as kind of the taskmaster or the facilitator of those groups. So the open-mindedness that they have and the connections that they're making just among different people and organizations that say, well, we haven't really tried this before, but let's give it a shot and see if it works. Let's learn from it and then apply those lessons to what can be done in the future to make it a more sustainable system going forward.
Well, thanks to you both. Thanks, Ian and Gina. If any of you have any questions for either of them, please put them in the chat. I see we do have one question from Lisa Shala. Hola, Lisa. If you have a question, Lisa, why don't you unmute yourself? And if you're willing to put yourself on video, that's great. Lisa's from a community foundation in Mexico.
Hi, thank you so much for this information. I'm really interested in learning more about how the first presentation was talking about the type of communication, how you were able to manage the communication between all of these teams so that there wasn't too much repetition of what was going on, or so that everybody knew what was going on. What were your main methods of communication that worked for you?
Yeah, that's a great question. Thank you, Lisa. One of the tools that I had to study up on fairly quickly at the beginning was a co-working application called Slack. And so, I know that there are various tools that exist. Microsoft has their thing, and there are all kinds of different formats and tools. But Slack was what we opted to use, and it allows you to create different channels and invite a broader access. So when you look at the Slack participation or users within our civic response team group, there are probably 150 people in that Slack space. Not all of them are involved in every single channel, or there's a food channel, for example, that the members of the food team get involved with, and they can share information in a live way. And then, of course, there are Zoom meetings. We have pretty much weekly meetings for each of the teams. And then I mentioned before the coordinating team, which is kind of the recommendation development. And for lack of a governance body, it's the kind of the decision-making body that helps the teams move forward. And then there's a broader community meeting that happens weekly on Fridays that we call the leadership team, which is really focused a little bit more on information sharing among the different teams and then other stakeholders and entities that have an interest or that have resources to bring to the table so that they can learn about the work of the various teams in one kind of concise format. So Zoom, phone, email, Slack, texting. I pester Gina and others as much as I can, but I try to do that judiciously as the facilitator. When I hear something from one team that I know that applies or that could be beneficial to another, I try to help make those connections.
Thank you, Ian. Sort of related to that, and sort of how the systems work. A lot of times, you described a little bit about the governance and how you have a coordination team and a leadership team. How do you get community voice into the decision making? Are folks sitting at the table? How do you ensure that you are making decisions that are really reflecting what community needs?
Well, I would tell you that we're not perfect. We haven't gotten there 100% to where I could guarantee that we're always doing exactly what the community opportunities would otherwise dictate or what the community priorities are. But I think we are always in a process of improving that. Various teams, and I'll let Gina kind of tell you about the food team, are very active in kind of recruiting in those that are on the ground in neighborhoods day in and day out that are doing this work professionally or just pretty much like full-time volunteers, and figuring out ways that we can help them, stay resourced, stay healthy, and help them get the resources that they need and give us the information we need to have that symbiotic relationship and working. So Gina has done that well, and maybe let her talk about their team.
I would say one of our most active partners on our team is the executive director of an organization that does health navigation. So not her expertise is not food, but what she does do is do door knocking and in the neighborhoods where we know that there's food insecurity. And so Bria Grant came in, she represents an organization called Unite MKE. And she quickly realized that as she was connecting that there was food insecurity, an increase in it for her families. So she's been a great conduit for us to make sure that we're getting community voice. And then, I think as we ask questions around, are we actually serving people? We've mapped out all the food in Milwaukee and where it's available, but we're still hearing we can't get it. And so I think the food team, we're not perfect, absolutely either, but we've done a good job of in some neighborhoods, really getting that community voice. And then we have tailored solutions to make sure, particularly around the delivery network, to make sure that we were responding when we heard that there was a challenge.
Wonderful, thank you. Michael Layton, hi Michael, how are you? Michael has a really interesting question. Michael, if you want to turn on your mic and turn on your video, you can ask your question.
Hi, Deborah.
Hey, Michael.
Thanks so much to you, Deborah, and CF Fleets for organizing these conversations every week. It's been really helpful to be connected to people, and I really appreciate these stories that you're all telling. The issue that I'm wondering about, and the conversation I'm having with my friends is basically, what happens next? Where do we go from here? And I'm curious, now that you've experienced this crisis, you've done incredible work in encouraging more collaboration across the various sectors in your city. I'm just wondering if you've given any thought, despite the overwhelming immediate needs that you faced, of how you pivot from this and think about the systems change in a place like Milwaukee, moving out of this crisis and trying to rebuild in a way that really enhances issues of equity.
That's another excellent question, and probably should be the subject of a standalone course, multi-days, multi-hours. But I would say the quick answer is many of the partners that are involved in the civic response team made a commitment organizationally even prior to COVID being an inkling to racial equity. You may know some of the negative superlatives that Milwaukee claims around segregation, around disparate and bad outcomes around racial equity. So like, for example, the Greater Milwaukee Foundation made a very explicit commitment with its grant making, with its civic engagement work and other things around racial equity. And that's, you know, similar to some of the other partners that are part of this work. And really early on, we tried to, you know, encourage leaders in the teams to think about, you know, the immediate term, of course, and prioritizing those immediate needs, but also thinking about the systems changes that are necessary to make sure that when we can emerge from this and start thinking again about the future, that we're doing it in a way that creates a better Milwaukee than we had before, explicitly around race and ethnicity and equitable outcomes. And like I had mentioned before, the economic recovery team has a very explicit framing with its charter and with its leadership and the involvement of different team members around, you know, making sure that Black and brown households, Black and brown businesses, Black and brown neighborhoods are prioritized with the kind of the theory that if those neighborhoods can succeed and get ahead and, you know, begin to build some net worth, then that's going to be good for Milwaukee as a whole. And I mean, again, Gina can kind of talk about how they're envisioning that around the medium and the longer term.
Yeah, I mean, I will say in the past several weeks, I think the conversation has shifted to that question. I don't know that we have an answer yet. I think, you know, our group is going through some logic modeling and theory of change work right now that we hope will sustain our commitment to equity and in the food systems. I think at a, you know, more tangible level right now, in some of the work that we're doing by contracting with restaurants, we are absolutely targeting Black and brown owned businesses and, you know, paying them a rate that is far above probably their food cost to make sure that we're helping sustain those businesses. We're also thinking about, as Ian was saying with the economic recovery team, how do we layer on some of the work we've done in these other groups? And I think the food and economic recovery have a lot in common. Can we also then start to offer small grants and technical assistance to small restaurants who are going to have to rethink their business model? You know, people aren't going to be coming in and sitting down in our tightly packed noodle shops like they used to on the South Side. And so I think we're thinking about additional, definitely additional resources to target those businesses and keep them there.
And one of the other kind of add-on answers I would just inject in there, I mentioned relationships and having trust, you know, within the context of what I was talking about. We need to tap into some of that trust and relationship, especially with city and county leaders who have, like I mentioned, authorized the activation of the National Guard and invited in even other police forces from other communities in Wisconsin. There has been turmoil, there has been violence, and ironically, you know, with Milwaukeeans expressing their First Amendment rights to address, you know, to air their grievances to public officials, there has been a violent reaction on some occasions to them expressing those rights. And we need to hold our partners in the public sector accountable for the decisions that they're making and have a really frank and open dialogue with them so that you know, they're doing the right thing, or they're being, you know, challenged to do the right thing in the short term, again, as we build some of these economic tools and some of these structural and societal tools for the longer run.
Are either of you funding more community organizing, and so that there's more voice in shaping systems going forward? I don't know, are these navigators in some ways community organizers? Just wondered.
So the answer is yes, not to answer for Gina, but I know that they are on funding, organizing. The navigators aren't necessarily organizers, but they can be coordinated with organizers. And our recommendation, I think universally from the civic response team, is that organizers that are on the ground already, that have all of the lived and, you know, kind of banked experience and trust in neighborhoods and communities, would be a good kind of mentor for them to connect with, so that they can amplify their reach and go much, you know, deeper, faster. But yeah, I mean, absolutely, that approach is important. And again, Gina can talk about, you know,
yes, we do fund organizing, and it's been essential to the Zilber Family Foundation generally, we fund in a place-based community development model. And so essential to that is community and resident engagement and leadership. So we've always funded organizing. I would say though, I would love to learn from any of you. I think one of the challenges we have in Milwaukee is that we have very siloed organizing entities here. And there isn't a universal, even an agreement on what community organizing means, or how we share information across organizations. And I think, you know, as we're getting these navigators started in the COVID response, it's still very unclear to us how they might work with health navigators who are already on the ground, or NSP organizers that are previously funded through the city. So that is an area of learning that I think the city of Milwaukee could really benefit from.
Great. So I have one last question before we turn this over to Len for our poems. I guess for both of you, how does this feel different this time? Is it you know, there's a lot of collective MCAT kinds of things, and obviously this is just responding to a particular crisis. But are you structured differently? Are you bringing different kinds of information to the table? Are there different people at the table? Is it more cross-sector? Is there something about this that feels like it's going to be more effective than some of these experiences in the past?
Gina, do you want to answer first?
No,
You've been at philanthropy much longer than me.
That's a good question. You know, I think when we started talking about adding an economic recovery group to the Milwaukee Civic Response Group, you know, I admit to having a little bit of a like gasp of like, oh no, another group, right? We have so many groups that are working on economic recovery right now. And I think the difference for me is that we're coming into this with there's an urgency. There is, you know, it's a very visceral right now that people are suffering, and then it is touching everyone in our community. And so I think that encourages more of a cross-sector partnership. I've seen an increased interest from the business community and from, you know, small businesses who are changing their product lines and shifting for the greater good. And I don't know that other crises that we've experienced in our community touch everyone in that way. And so I think that's a driving force that we can really leverage. I would say the other difference, one, we're not together. And so I think the physical separation in some way has driven us to congregate more often and bring different faces to the table. It's, you know, being able to call in for a Zoom has made it maybe somewhat easier for us to connect with those frontline workers, because they're literally on their phone delivering food while they're on the meeting with us. And so I think we've sort of shifted the expectation that we have to either be all in the same place at the same time, but that we can, as long as we're touching base and committing to a shared set of goals, that we need someone driving the agenda and someone doing the follow-up, but that people can all tap in. And so I think the format has made it easier for us to connect more and be more diverse in our participation.
Interesting. Who would have thought, huh?
Right.
Ian, what's your thoughts on this?
Yeah, one of the things that I would note that seems different to me, and like I mentioned, I'm a short timer as it relates to involvement in philanthropy from the kind of the funders side of the table. But it seems different because we have entities and partners that historically haven't been willing to ask for help, or willing to admit a little bit of humility, or, you know, admit that they need the help, to come to the table and say, we need your guidance, we need your help, we need your advice. This won't work unless you're involved. Together, you know, from different sectors. And I think that's different. It doesn't seem to me the way that Milwaukee has historically functioned. And I would also say there's an element of again, not to kind of air a lot of dirty laundry from Milwaukee, but there hasn't always been a lot of cooperation, at least in this kind of current generation, between Black and Latino Milwaukee. And I think that that is changing as a matter of necessity and as a matter of just outright strategy, that the leaders in those two communities are realizing that you can't get as far down the path to success and to prosperity without each other. And I think it's a sense of shared, not to invoke too much of James Baldwin, but it's a sense of shared destiny that we realize we can't get there unless we do it all together.
And so when you say, do I hear you saying philanthropy has come with more humility and a willing to talk to learn from community? Is that what I'm hearing you saying?
I'm saying that, but I would also say the public sector, probably most notably, is coming to the table and saying, hey, wait, we need the rest of Milwaukee to join us in this. We can't just do it and think that whatever we're doing is the answer. Right.
So if anyone else has a quick last minute question, please type it into the chat. We will see you in 2 weeks, in June 18th, for our next webinar. And there's a good chance we're going to be talking about communications in 2 weeks. We've seen some really remarkable work of communications. So given that we don't have any other additional questions, I will turn this over to Len, who has 2 really beautiful poems for us at this time. Thank you, Ian. Thank you, Gina. And thanks to all of you. I will turn it over to you, Len.
Thank you so much, Deborah. And thank you again, Ian and Gina, for your comments and sharing your story about your work on the ground. I'm going to be reading 2 poems this afternoon. The first one is by Ross Gay, and it's called A Small Needful Fact. Is that Eric Garner worked for some time for the Parks and Rec Horticulture Department, which means perhaps that with his very large hands, perhaps in all likelihood, he put gently into the earth some plants, which most likely, some of them, in all likelihood, continue to grow, continue to do what such plants do, like house and feed small and necessary creatures, like being pleasant to touch and smell, like converting sunlight into food, like making it easier for us to breathe. And the second poem is actually an excerpt from Langston Hughes's Let America Be America Again. Let America be America again. Let it be the dream it used to be. Let it be the pioneer on the plain, seeking a home where he himself is free. America never was America to me. Oh, let my land be a land where liberty is crowned with no false patriotic wreath, but opportunity is real and life is free. Equality is in the air we breathe. Oh, let America be America again, the land that has never been yet, and yet must be, the land where every man is free. Oh yes, I say it plain, America never was America to me, and yet I swear this oath, America will be. We the people must redeem the land, the mines, the plants, the rivers, the mountains, and the endless plain. All that stretch of these great green states, and make America again. Thank you so much for joining us this week, and again for Ian and Gina, and we'll see you back in 2 weeks. Thank you so much.